Welcome to Research Renaissance, presented by the Karen Toffler Charitable Trust. Embark on a journey into the forefront of cutting-edge brain science as we feature insightful discussions with a diverse array of guests, from early career researchers pioneering groundbreaking science to influential voices in investment communities, policymaking, and research institutions. Together, we delve into neurological diseases, their causes, treatments, and the quest for cures. Join us in advancing our understanding of the brain and addressing its ailments. Welcome to Research Renaissance. I'm Deborah Westphal, your host and guide through the fascinating future of the brain. Joining me today is Dr. Marci Nielsen, a leader in healthcare policy and executive management. We will be discussing the importance of patient advocacy, changes in healthcare policy, and relationships to research for a better future for all of us. So let's dive in. Welcome, Marci. It's such a thrill to have you today.
I am so pleased to be invited. Thank you for having me.
Yeah, I'm really looking forward to this conversation. You have a very interesting perspective, and you've worked across many different aspects of healthcare and policy and government. Let's just start with who is Marci and what is your perspective here in the broadest terms?
I am happy to share with you, and I'll try to give you the abbreviated version. I'm not sure that my resume necessarily makes sense to the average bear. As you point out, I have worked in a lot of different facets of health and health policy, and many of the adventures that I've had weren't necessarily planned, but I began actually working in hard sciences. My undergrad was biology. I also double majored in psychology, but I wound up doing the Peace Corps and working in public health and sort of fell into that work. I fell deeply in love with it and thought I would have a future in global health policy, and was working actually at George Washington University for Tony Fauci's electron microscopist, Dr. Jan Orenstein. So I was working in a lab when I volunteered for my United States Senator from Nebraska and was kind of doing that on the side, fell in love with health policy. And it really was a shift in my career then. I worked for Bob for a few years. I went back and got a PhD. I'd already gotten my master's in public health, got a PhD then in health policy and management. And that started a career in advocacy, government, academia, and all of this on top of a working class background. My parents didn't go to college. I grew up working on farms and, really didn't even dream that I would be able to have the sort of future in science and health that I've had. And I feel extraordinarily grateful.
Yeah, it's super interesting that, I think you were in the Army Reserves.
I was.
Before or after Peace Corps?
That was before. That was when I was 17 to pay for my undergrad. That was a little bit of a fight with my dad about where I'd go to school. And I resolved that by getting on my first airplane and flying to Alabama for Army basic training.
Yeah. So you said your initial was global healthcare policy, but now you've kind of moved to public. What is the difference, and where is that influence there, and what was so fascinating about the public policy?
I loved that question, and I rarely get asked it. Global public health really, for the most part, certainly when I was in training, which was in the early 1990s, was focused a lot on development, is still focused a lot on development, and largely infectious diseases. And I was able to work, as I said, for Dr. Jan Orenstein, and I was doing work in HIV/AIDS research. This was the early 1990s. And what you found when you were working in that space was that we were suffering, we Americans all over the world, from a disease that we had no cure for. We had very few ways in which to manage the symptoms. And people were dying of diseases that were largely managed in the United States, strange opportunistic infections. And going down that path where I learned more about HIV/AIDS, I also learned a lot about the US health system, or lack of system, as many people say, how broken it is, how difficult it is to get access to care, especially for people who don't have insurance. And that was my pivot to working on health policy domestically. It was 1993, 94. The Clinton health reform debate was on. I have worked, as you see, when you look across my resume, I've looked for a few politicians, a few elected officials. Most of them were sort of blue purple politicians, if you will, working in red states. So that means I come at things from a political perspective that's largely centrist and really has to balance multiple different constituencies when you're working for a blue elected official in a red state. So health reform was fascinating. And my boss, Bob Kerrey, worked with a number of Republican senators and Democratic senators to try to chart a path forward that would be bipartisan. That effort was called the Mainstream Coalition. They introduced legislation. I learned more than I would have ever dreamed possible about how to craft a law. Ultimately, of course, we didn't have reform in 94. The Clinton reform tanked. The Mainstream Coalition bill didn't get far, but that launched my interest in health policy and management and led me to Johns Hopkins, where I did my PhD and, of course, was surrounded by students from all over the world. I maintained my interest in global health. And actually, after I worked for the governor of Kansas, had the opportunity to work for Tom Frieden, who manages a not-for-profit, who started a not-for-profit focused on global health. So I think I'm one of the rare individuals, perhaps, who has a groundedness in domestic health policy in the United States, but has also dipped her toe in global health. And you would think that there are a lot of similarities, and there are, but the differences are vast because in the United States, we fund healthcare quite differently than they do in most industrialized countries. About half of all money in the US health system comes from the private sector, and the other half from the public sector. But in most industrialized countries, the bulk of their funding comes from public coffers. So they make health policy quite differently than we do in the United States. And there are some upsides and downsides. One of the upsides, which circles us back to the work of the trust and your work, is our ability to invest in science and research endeavors, pharmaceutical investment in research and development. We really are world renowned, but we do that at the expense of not funding well programs that make health care, affordable health care, universal for everyone. That is the trade-off that we make. And of course, we do have the most expensive healthcare system in the world. And it's often not as high quality as we'd like it to be for everyone. For people with great insurance, there's no better health care that you can find in the world. But for many of us, it's a very hard system to navigate. It's very fragmented based on the way we pay for care. And we have a long way to go to fix it.
Yeah. Yeah. I'm sure we'll get into this a little bit more because, and you alluded it to your experience with HIV and AIDS as these underrepresented groups, or these groups that, diseases or conditions may emerge that haven't been focused on as a patient group. You can only imagine the political aspect of that, or the emotional, or even the social aspect of that. And it's something that as you said, I think is really it's really important, but it's very, very hard to change. And I would like to kind of delve into that a little bit more later, because I do think that shows up in our research too, of who we're researching, how we're researching, where some of the specimens of brain research, where we get the brains to research. I think that shows up pretty frequently. So, I want to go to just kind of jump to when you were chief advisor for the COVID-19, because that here again, this is probably pretty politically charged, lots of different aspects, lots of opinions and theories out there. But you were the coordinator, I believe, in Kansas. And, what were some of your most significant challenges that you were faced while you were managing this pandemic response, especially with information and how we were learning it, how it was coming out? Can you talk about that? And, what was the relationship to any kind of scientific discovery as we tried to navigate this?
Yes, I would be happy to. Although talking about it does give me a little bit of PTSD.
I'm
Yeah, I
sure.
was. I was Governor Laura Kelly's chief advisor for COVID coordination. And that meant that I reported to her, but that I worked very closely with the Kansas Department of Health and Environment, as well as the other Kansas agencies that were managing the pandemic. There were so many challenges. I came on board in September of 2020. I was working on a volunteer effort that we may have a chance to talk about on this podcast. But the challenges in the governor's office were really sort of astounding. And it's hard to believe that we made it through what felt like on some days sort of the end of the world. Talking about the pandemic now, it is politically fraught, as you alluded to, but it's still so important because we discovered so many things about our healthcare system that were broken. We knew, but we found more, and we haven't really mustered the political will to fix them all. I would say that the challenges changed over time, but early on in the pandemic, the major challenges were how we balanced the information that we were getting out of the White House and the CDC and FEMA. The governor brought me on board literally saying, Marci, this is the pile of information I get every day from Washington, but it's just data. It's not information. And I need information that I can trust, that is Kansas specific. And I need somebody to focus on this full time while the agency actually tries to stop the spread of COVID. So that was my mission as I was coming in the door. I am, as I mentioned, I'm trained as a PhD. My PhD is in health policy and management with a focus on social and behavioral science. And I'd had a chance to work on several scientific studies, and as well as working at the University of Kansas Medical Center for 9 years. So I did very much believe that following the science was our obligation. I think in a pandemic, that's far easier than it sounds. First of all, in an emergency like that, there are so many moving parts and agencies involved. And so leadership really has to come from those elected officials who are balancing multiple perspectives. So the perspective of the scientists, the perspective of those advisors who are focused on the economy, those advisors who are focused on schools, the logistics. So we had the National Guard playing a big role in Kansas. And then, of course, the legal structure that you have to work within. So important to recognize that as much as science should be driving policy, it's one element of all the multiple things that a governor has to balance. I think that's the second biggest challenge is this belief that in the time of a public health emergency, it's the federal government that's in charge, when in reality, the statutes make clear that it's the states and local governments that are in charge. And at the time that COVID broke out, we weren't getting clear information from our own federal leadership. And the science there at the White House was even in question from folks who were working at the White House. So they had their own challenges with sifting through science and deciding what they were going to share and not share with states. This is all the while governors are in charge, not having adequate information to make decisions. And the world around them is changing on a daily basis. So I think I've painted for you a very scary time, and it was. We'll talk a little bit more about how we managed that. But I would want to point out that the challenges managing COVID changed over time. So if at the beginning of COVID, the challenges were about understanding what was really happening so that we could slow down the spread and prevent people from dying. You'll recall early on, we didn't have a way to test for COVID. We didn't have a way to treat it. We certainly didn't have a vaccine. But once the vaccine was developed, which I consider to be one of the most truly magnificent feats of science, and I can't think of anything that better demonstrates our need for continued investment in science. But the challenge for us in government became about how to operationalize getting vaccines to everyone, how to communicate why vaccination was important, and then how to move from a public health emergency to our reality now, where people are tired of COVID and patience and trust have evaporated. And yet we still need people to be vigilant about taking care of themselves and their families, but also their communities.
Yeah. Yeah, it was as you were going through there, I was feeling a little bit anxious too, because it was just really hard at the very beginning to just kind of get footing of where things were. And, you know, just my background in understanding how Alvin and Heidi Toffler thought about change. And, it was just a really accelerated time that we just didn't, and things just seemed to be going real time. And, I wonder if we had more time, especially like given I'm very concerned with this kind of thing that we're being faced with around Alzheimer's and dementia. It's, more and more people are going to get it. What does this mean for families? What does this mean for healthcare? We have the time. It's not like a pandemic that has happened. It's kind of landed in our hands here. But it could be just as stressful with, to our public health system and the surrounding kind of mechanisms that support that. And I know that kind of as some of this collaboration in public health that you've done, can you speak to that time and that change and how important it is for us to be more kind of future focused? Because you did mention early on that it's hard sometimes to get people's attention that change needs to happen. And then all of a sudden we're caught in a time where we need to act, but our operational systems, processes aren't there to support.
Yes. And I think were it not for COVID, most people don't fully appreciate what public health does for us every day. You know, making sure that the water is clean and the air is breathable and our food is safe and we know how to take care of ourselves. We in this country in particular underinvest in public health because we don't see it. But also, to your point, it's not an acute emergency. We have short attention spans, and COVID was front and center of everybody's attention, and it needed to be dealt with immediately. And we threw all kinds of resources at it, and thank goodness we did. I mean, truly, thank goodness we were able to come together as a country and make decisions on behalf of everyone, fund all kinds of programs to help states and local government. But over time, as our patients grew thin, when we were asked to change our behavior and we weren't certain we were trusting the science anymore, and we made mistakes. We made mistakes in public health in how to communicate what we knew and what we didn't know, which then led to public trust being undermined. And that's very difficult to get back. It's very, very easy to lose and very hard to regain. So when I think about Alzheimer's and I think about dementia and I think about, as they say, the, gray or silver tsunami that's coming toward us, and we know that the cost of treating those illnesses, let alone managing those illnesses, let alone all that we ask of caregivers who are taking care of our loved ones, so many resources are going to be needed. And are we adequately preparing? And I was very encouraged when I listened to your podcast with Tom Hubbard. I learned so much in that podcast, and really appreciated Nihai's leadership in trying to bring collaboration from multiple different sectors to focus on these problems before the tsunami is on top of us, and was very encouraged when he talked about all the number of drugs in the pipeline that we think are going to help us manage, but also the brain research that leads us to believe that there are ways to prevent some of the sequela of, you've got the gene that predisposes you, but you may have the genotype, but not the phenotype. And yet, how do you make sure that the policymakers of today are focused enough when the investment needs to be made now to ensure we can prevent a future catastrophe? And there aren't easy answers, but I would say that we've got a lot of really smart people working in that space, to include the Toffler Trust. And your investment in young scholars and startup sort of endeavors is so important.
Yeah, I really appreciate that, and it is that investment, that emphasis early on will save time later on, and
That's exactly
and
right.
costs too.
Mhm.
A little bit today will save down the road. You're the co-founder, or you're a co-founder of a project called the CVKey Project, and it's supposed to help communities reopen during the pandemic. I would imagine that was a very collaboration. It had lots of perspectives. Can you share what CVKey Project's mission and the value it delivers, and then how do you see the technology and scientific research helping in because we will probably be faced with something very similar again, whether that comes from a pandemic or climate issues, or sweeping issues like we just talked about, which is the grain of a society. Can you please share your thoughts there?
Yes, I am so happy to, because this working on this project was really one of the highlights of my career, and it happened by complete happenstance. I'll tell you a little bit about the mission and how it all came together. But the CVKey Project was really designed to help communities responsibly reopen during COVID, importantly, without compromising privacy. And we did this work at a time when there was no testing, as I talked about earlier, no testing, no vaccine, lots of confusing information that was changing all the time. And so what CVKey did is we took all that data, symptoms, exposure, CDC guidance about both quarantine and isolation, and we converted it into simple, actionable information to individuals, letting them know what their risk for COVID was and where it was safe and not safe to go in your community. And it did all this through an app on your phone, which was astounding to me. This was a full time effort by a group of volunteers who were mostly from Google, who I later learned were called Zooglers. And this was led by an amazing guy by the name of Brian McClendon. He is a software developer who led the development of Google Maps and Google Earth. And he is a true Kansan. And he basically recruited many of his engineer friends who government was shut down, work was shut down, and he asked them to get involved in this project. Manik Gupta, an MBA who was the former chief product officer at Uber, was another co-founder, as was Walid Kadus, who has his PhD in computer science and artificial intelligence from New South Wales. Amazing guy. And what I learned from them was a lot about efficiency and clarity and deadlines and product development. And that was something that we in government and public health, many people wouldn't put government and efficiency together. So I had a lot to learn. But he recruited all of these former employees and friends. We worked on it all day, every day. They were engineers. I was recruited to help the effort by the then governor of Kansas, who I had known since she was a state senator. And we had these brilliant engineers and product developers, but there was no one on the team who spoke CDC or government or public health. So my role was to explain, here's what the public health laws are, state and federal. Here's how to make sense of the fast changing guidance from the CDC. Here's what a symptom checker checklist ought to include. And then they took that information, turned it into an app that allowed a person to enter their symptoms and risks every day. And they converted that into a risk profile that was color coded, turned that into a QR code that could be scanned and allow entry into buildings that were deemed safe for people to be in. This effort was deployed at the University of Kansas, where ironically my twin daughters were going to school. And the effort where this turns back to your work and science, and your I think accurate connection to the need for collaboration across sectors. I've never felt that more than when I worked on CVKey and realized how much we're missing in public health by not having these brilliant, out of the box, quick thinking, well trained technologists. We, in the underfunded world of public health, really need access to them, and not just in an emergency. We also needed to be able to connect to government so that we could tell the university that was public funded what we were working on, what we could do to help them reopen their classrooms. Because, of course, what we found out and we suspected at the time was that it was really important for students to be together, to have that socialization, and the impact that COVID has had on our mental health then, but also now, continues to be something that I don't think anyone had appropriately planned for. Where this gets back to science is, so much of what we do in science now really is driven by technology. And these technologists that I was able to work with are the same technologists who are now out working in various different fields. What they've learned during COVID, what I hope I was able to teach them, was the ways that public health and healthcare delivery need them, because our systems are still broken. And I hope I can spend the rest of my career proselytizing to people in various different sectors from various different perspectives and backgrounds. We got to work together, because only together can we solve what are such gargantuan problems that society really needs us. And climate change, of course, is the first thing that comes to mind.
Yeah, as you were talking, I was wondering, and I just can't help myself, but I was wondering about a very similar app that might come out of this that you could have to really understand: do you have access to that clean water? Do you have access to that clean air? Do you have access to that safe food? Because as you travel across the United States, and you mentioned this, community to community is very, very, very different. And not just at the state level, but very regional, that we have these issues. Yet we're still all this is very connected. Water supplies are connected, and food supply chains are connected, and such. And that, I don't know, but I wonder a lot if at some point around understanding the brain, how much of what's happening with us from a health and a brain perspective is environmental. Is it the access that we have to some of these environmental things like good water, good food, access to safe air, or are we the increase of these diseases being caused by too much plastic, too much pollution, too much this, too much that gets processed through the body that ends up in the brain? And I do think you're right. Technology can help us understand those hidden relationships that we just don't see right now.
Yeah, I think that is so right. In preparation for this interview, I was doing some homework, and the work that we see on the GLP-1 agonists. And in the field of public health, we, of course, have been telling people for a long time: change your behavior. This is all about calories in, calories out. This is about willpower. And not that those things necessarily were wrong, but it's more complex than that. And as we learn how those drugs actually work, they work on the brain as well as on the gut. And people who have worked in this space for a long time, it turns out they've known this for a while. But the shift that we have in society now, as we look at obesity and realize it's connected to our brain, and maybe we should think about this differently. Maybe we should treat it like a condition, now that we know that not only do these drugs potentially help us resolve these problems, but diabetes, and it turns out other cardiovascular conditions and potentially depression. And then what is the role of the healthcare system and health insurance to pay for access to these drugs? Because of course, in the world of health insurance, as we develop all kinds of new specialty drugs and we see the cost trend increasing year after year, there's a real concern about, well, if we gave these drugs to everybody who needed them, this would be untenable. And it's a question then of our budget and our values and of ethics and who should get access. I mean, I certainly don't have answers, but to your point, as you start to unlock some of these mysteries of the brain, and maybe we as a community, as a country, think differently about addiction, mental health, what is our obligation then to treat these conditions that were once very stigmatized and we blamed individual behavior for, and we realize the complexity of the conditions?
Yeah, and boy, this could be a whole long conversation because the behavior change in an environment where you don't have access to healthy food. To go into the grocery store, it's more expensive to buy healthy food than it is to go to 7-Eleven and get a hot dog and a Slurpee. And some people just don't have the money to go in and have, fresh food delivered every day or, that kind of access. And so it starts with, what is available to people. Healthcare, many insurance companies don't really reimburse people to take care of themselves. Some do with gym memberships, and but if you want to take up running, they're not gonna reimburse you for a pair of running shoes or walking shoes. You're on your own, and so many, and this goes back to these communities. There are many communities that are just you know underrepresented or just not seen, that don't have the ability, which then does lead to health issues. And then we, as you say, we stigmatize that, and then we question, well, this question about having access to the drugs when we could work that way upstream, which is, I would imagine, a healthcare policy debate that has to happen in this country.
That's right. And none of the answers are easy, and the science isn't decided. So there's a lot more that we have to learn. But, and I say this with great love for all of the biological science that we have been able to do and really lead the world in, what we haven't invested as much in is the social science to understand the why of how we make investments, how we talk to each other, how we collaborate. It's part of the reason, and I keep coming back to the trust, but I think about the evening that I first met you and the dinner that you had and the people that you invited and the questions that you posed. I mean, I've been in Washington, D.C. for a long time, and I've never been to a dinner like that where everyone was free to just offer their perspective, and not with their hat on of I represent this organization or this perspective, but to throw out big, hairy, audacious questions and goals and to just have candid conversations.
Yeah, it's these problems, and I appreciate the recognition on these dinners that we have, because that's the main purpose, is to have these conversations without having to represent a team. When we have to team up, it becomes a competition, and it's going to be very, very hard to solve some of these if you're in competition with the other team. Which kind of leads me to, your experience with working with legislative, in that area, or, around health as a health lobbyist or with other lobbyists. What is that dynamic, and how effective is it from of an advocacy perspective? And, do you give us some hope that these things are are moving forward, even if they are slowly moving forward?
Yes, I can give you a hope, and I can tell you a lot about that world. I started in policy working for my United States Senator, so I had a lens on the world that was very federally focused. And even though I from Nebraska and my senator represented Nebraska and maintain all my close ties, my parents still lived there. The difference between federal health policy and state health policy is significant. It is very hard to get things done in Washington because things move so slowly, because there is such a partisanship now that it is just slowing down progress on things that shouldn't be political, to include COVID, quite frankly. Where I think there's hope is working at the state level and at the local level. And at the end of the day, all politics is local. I mean, the role that relationships play in getting anything done is far more significant than people realize, which is not to say that all the science and the data is not absolutely necessary. It's just often not sufficient. And so the role of good advocacy, patient advocacy, organizational advocacy is to bring to life what the data are telling you, and to bring stories that policymakers and the public and the media can relate to. But it's challenging now because it's just a sensory overload of stories and social media. And how do you sift through the inundation of information and get your story across? That's where the very special role of patients and scientists and doctors often are the role that breaks through, because it's who we trust. They're people living with the condition who often have nothing to personally gain, right? The cure that they're helping advocate for isn't something they're often even going to see in their lifetime. So there's a selflessness there on behalf of patients and families. On the scientists who have given up, I shouldn't say given up, have committed their whole lives to scientific discovery. And on the providers, the doctors who treat them, who weave together what the science is telling us with the reality of patients' lives. I mean, I just can't emphasize enough how important that is. And it's a lot to ask when these people are already suffering and or very busy. Can you take time out of your schedule now to explain this to the rest of us, to try to make change in public policy? But their voices are absolutely critical.
Yeah, as you're talking, I was wondering, we went through the last, 4, 5, 6 decades. We went through a period of globalization, right? Information, technology, business globalized, politics globalized, and we're all connected around the world. But as these problems, you know, or opportunities arise, what I'm hearing is there may be this, movement to be much more regional, much more kind of focused, that, we may be the right word is not breaking point, but the federal government was never set up to be the representation for all across the United States. That this growing need to take care of these regions, or at the state level, especially when things get very, very complicated. That's what I'm hearing you say, is that we need to break the problem apart a little bit, and focus solving it at a local level, and then bubble up those solutions to other places to adopt or adapt, but not try to work it at the highest level of the roll up. Is that what I'm hearing?
It is. They say that the states are great laboratories of innovation and democracy. And I think that that's true. And I started my career with a perspective that was let the federal government lead, because we can have one solution for all 370 million Americans. And oh, how young and simple minded I was. Um, the gift of having worked at the state level for so many years is understanding what we needed in Kansas differed from what they even needed in Nebraska, where my parents still are, which very much differs from what the priorities might be in New York or Florida. And so working at a state level, and some of these problems have to roll up and be resolved at a federal level. I'm not saying the solution should be limited to the state level, but it's so much easier to get to know your local elected officials and to get your story out locally and to destigmatize. I was interested in Tom talking about the stigma of Alzheimer's and dementia. And my aunt had Down syndrome and then did live long enough to have Alzheimer's and lived in an era where they took my aunt from my grandparents to live in an institution for a long time because that's how we managed problems in at that time. And thank goodness she got to come home and live with us and her family, where then we could see how all these things are knitted together and how we all need to take care of one another. And I could grow to know her and tell her story to my elected officials. It is the little things that roll up to the big, as simplistic as that sounds. But you had said, give me a message of hope, Marci. And my message of hope is not only does that ultimately, all of those forces coming together, does it change things? But it literally also changes the life of the person who has decided to invest in the change. I literally do not know what I would have done with myself had I not been able to work on the CVKey project during COVID. I threw myself into that project because I had the skill set. And what a gift to meet all these engineers and be able to help them. I don't know that they always felt that way about me every day, as I was like, no, not optional. You cannot include a button that says get out of quarantine free. That's not a thing. And that really happened. Uh, the personal reward that I found in being part of the solution, I guess, is what I would hope people have the experience of someday. If they're not part of that world of advocacy now, when their schedule and their life circumstances allow, just know you are helping everybody. And by helping everybody, you are also helping yourself.
Yeah, I think it's one of the biggest thrills I have with the trust is to be talking to all of these researchers or around their network of support. Is there is such passion and focus and dedication to solving hard problems. These people, they spend their life studying a protein or a disease or trying to produce, the best information for our understanding around disease. And, small companies get started and entrepreneurs innovate, and we don't always see that. And we don't always tell those stories because especially recently, it's all kind of doom and gloom and it's all broken and it will never be fixed. But I think, you paint a picture of hope, and I always have that hope just because of the people I get to hang out with. You did mention the area of trust though. And, that trust kind of took a big hit. It was kind of failing before COVID, but it really took a hit in some of our traditional institutions around the government and, law and even the military. And, how do we build that public trust again? I mean, I'm hopeful we will, but because things move in cycles. But, what do you see are some of the key factors that to start that process or accelerate that process of building trust?
Well, there's sort of a framework for good public health communication that sadly we didn't follow very well during COVID. And I think the recipe is probably generalizable to additional audiences. And the first tenet, if you will, that's very hard for us in these partisan, kind of egotistical times. The first rule is say what you know and what you don't know. And because we don't feel confident that telling people what we don't know will lead people to change their behavior, we hold back. We tell them what we want them to know, but we don't explain what's still sort of up in the air. And that happened at the beginning of COVID. People often point to the guidance that we were receiving around masks early on. And we did make some big errors. If we didn't want people using masks because we wanted to preserve masks for healthcare providers, then that's what we should have said. Instead, we just made it very confusing by saying, yeah, you don't need them. Wait, you do. No, now you're mandated. So we've got to break through our own pride and say what we don't know. Obviously, providing timely and accurate information, the timely piece is really important, but accuracy is hard. Accuracy is hard when the target continues to move. And so the next tenet is being transparent and honest and openly admitting mistakes. Very difficult for us in this time of social media frenzy where we want to just repeat on repeat people's mistakes. And I recognize people's reticence to put themselves out there. There are many other things on the list, but the last thing that I would mention is just the importance of tailoring messages to different audiences. And the reason why I specifically want to say that on this podcast is because we in science can be rightfully accused of poor communication, in fact, even elitism, when we don't stop and think about what it is we want the person in front of us to take away from the conversation. It's far easier for us to speak in our jargon speak and to feel like the most important communication is what we put in scientific journals. Absolutely important. But I would argue that's not the end of it. Now convert what you're doing in science into communication that is accessible for people like my mom and dad to understand and value so that they're, you know, taking it to their elected officials. This is worthwhile. This is important.
Yeah, and I think you use the word tailor the information, not use information to mislead, which sometimes that term tailoring the information is, well, we'll just kind of trim it to mislead or to guide somebody into the belief. And I just want to clarify that you are just talking about, communicating with people to where they stand, not where you stand. And I think, that trust piece that you're talking about, there's both sides. And when you tailor that information, when you deliver that information to people as to where they stand, if, your parents can understand it, then you have to trust them also for, that they have that, that information and they will act accordingly and behave accordingly to their best interest. And, I think in this world of just information saturation, that trust has to go both ways. That there's a lot of smart people that do their research and they dig in and they try to understand. We need to trust that they're not needing to be spoon fed. They just need to be given transparent, easily understood information.
That is exactly right. And I'll tell you, during COVID, when our legislature was very reluctant, if not adamantly opposed to some of what the governor was wanting to do in terms of managing COVID, it became increasingly important for us to just share everything we knew. So we created a number of dashboards that we made publicly available with the raw numbers as well as with the indexes, if you will. So we had a dashboard that was the social vulnerability index, so that we could be really focused on equitable vaccination across the state. So we could share who wasn't getting vaccinated and who needed to be vaccinated. We had county rankings to point to those places that were doing a good job managing the outbreak in their schools, in their communities, who were vaccinating, testing, etc. We had a long-term care facilities dashboard so that we could see whether the people who were taking care of loved ones in nursing homes were vaccinated. We had a dashboard for schools so that you could see where the outbreaks were. You could see which policies every school district had. So there is a way, when you can't necessarily agree on the public policy, there is still a way to move forward by being willing to take information and break it into chunks that people can understand and then share the data. And yes, people will do with it what they will. And yet, I just feel like Wikipedia as our model, there are enough of us that care enough about enough things that we're kind of able to apply our own checks and balances. And we did that in Kansas to great effect.
Yeah, and I think that applies. I mean, COVID is still kind of the one that still sits with us as traumatic. If I remember correctly, the AIDS epidemic was the same way. A lot of misinformation, a lot of the GLP-1 kind of drugs are going to fall into this. Some of the misrepresentation around OxyContin and what was going on there. And so this is not something that we don't, haven't been faced with. We just seem to be repeating it. But as time goes on, this information, we've got to learn how to deal with this with ubiquitous information, that the public has access, the public can talk to each other. And some of the old ways of communicating to the public, top down, aren't working. And so, that's kind of what I'm hearing as far as building back the trust. Is it's not a top down, it's more of a side to side. And we need to kind of change our behavior around transparency. And I love that you say, tell me what you don't know and what you do know at this time, because it changes tomorrow and it's going to change next week. And so just be honest with that. So, I hear your passion for public health and the health policy, and how do you stay motivated? I mean, you made the earlier you said the rest of your career you want to continue this. What's that motivation? What's that passion that just drives you to just not hang this up?
Well, a little bit, I guess, of that sort of Midwestern optimism work ethic is a part of it. But I will say that when I think about that question, the first thing that comes into my mind is this quote, which is, from everyone who has been given much, much will be demanded. And I think I have been given so much as a first generation college student to be able to go and get my PhD. I've got an obligation to take what I know and help others know it too, to be able to work in the halls of Congress and learn sort of the tools of the trade, as icky as they sometimes are described. I feel like I've got an obligation to take those skills and share them with people who are trying to take care of their loved ones in their community. But, with COVID, I have to say that I was motivated before COVID to try to do my part to fix the broken healthcare system. But post COVID, I feel so passionately about how we, in particular in the United States, need to weave public health and healthcare together, and the connection is science. And so all of those obligations are met with, I guess, an energy and a passion around ants in my pants. I got to do something.
So, what's your greatest hope for the future?
Really the next generation. I mean, I am very gifted in being able to go to school as long as I have, but my greatest gift is to be the mother of twin 22-year-olds who just finished college themselves, and they are so much wiser than I was at their age, and equally passionate, not about health policy, it turns out. I think they're kind of over health policy. But I do think they're going to help fix our mistakes. And yet I think there's some real healing that needs to happen post COVID. I was watching this sort of bizarre documentary last night about the soccer match between Great Britain and Italy, and the near catastrophe that happened as the excitement for the game built up. And it was the stories of the people who bought the tickets and were inside just trying to enjoy the game, but like people were losing their minds, and the people on the outside who were ready to do anything to break in. And I'm sort of watching this. I love documentaries, but the last quote really struck me, and it was a young man who was part of the break-in who, when the interviewer said, are you ashamed of what you did? Do you regret what you did? He answered with this: no, I'm not ashamed, because during COVID, when elected leaders made me stay in my house and I was alone and I was isolated, and they were out partying when they weren't adhering to the rules, I needed to get out and be free. And he said, I was depressed. I'm still depressed. All of these things do get connected. And I thought we owe it to the next generation to not leave everything quite so broken. But I do believe they're going to come in and help us weave back together a lot of really important things like trust.
Yeah, that's beautiful, and I agree. There's priorities are shifting. People question some of that. They, but I do think this care, this humanity, this connection, you can't be around. You can't go to a game or an entertainment event or a concert without seeing people just enjoying each other, and just that humanness that that we all share. So I appreciate you leaving us with that message of hope and wonderfulness. Marci, this has been, it's been fantastic. You and I we could talk forever, but sadly we have to kind of draw this to an end. And, but in the future we'll talk again. But, how do people get in contact with you? Like you've got so much to share. I know you've got, you do consulting on the side. How do people get a hold of you?
Probably the easiest way is through LinkedIn. I'm pretty active there, and you could just find me under Marci Nielsen. And you can email me through LinkedIn, and I would love to learn more about all the great work that the scientists that you support and advocate for are doing. So,
Yeah.
love to hear from folks.
Wonderful. And the general public, the general public that want to become those advocates that
Yes.
that you talked about. So, Well, wonderful, Marci. Thank you so much. I really appreciate your time and your wisdom and really your passion. And I hope you don't hang it up anytime soon, because we need people like you.
Well, thank you. I'm so honored that you wanted to talk with me. And yes, this has been great fun and energizing. So thank you.
Thank you for joining Research Renaissance. For more information and to stay updated, subscribe for more episodes and visit our website at tofflertrust.org. Feel free to call us if you have any thoughts, suggestions, or just want to find out more about the Karen Toffler Charitable Trust. Until we meet again, onward and upward.